Thank you for joining us on Health Diary. My name is Gladys Gachanja, and today we're coming to you from the 4 Points by Sheraton here in Hurlingham. Now, I want you to imagine a part of your body as you know it all of a sudden starts to grow bigger and bigger and bigger. You have no explanation as to why, but at some point you can tell this is not normal. Gigantomastia is the excessive growth of breast tissue. Now, this can turn to essentially what is supposed to enhance the femininity of a woman into a living nightmare. Today, we learn more about gigantomastia and the reality those who live with this condition have to face, starting with this fact of the matter. Gigantomastia is a rare condition that causes excessive growth of the female breasts. The breast growth can occur over time, though in some instances, they can grow 3 or more cup sizes within a few days. For some women, gigantomastia can occur randomly, and for others as a result of underlying conditions. It is considered a non-cancerous condition, though it can be physically disabling if not treated. Gigantomastia also goes by other names including breast hypertrophy and macromastia.
Growing up, my belly was so huge. It was big, 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 big. And now, after so many years, I just learned that that was the body's way of naturally just adapting to having big breast. When I hit my adolescent age, they just grew. I cannot even tell you that there was a point I remember that they were small. One time my parents took me to a doctor, and when they checked me, they were like, you can just have your exams, the high school exams, and then you can have the surgery done later. But I wasn't really for it 100%. And then after a few years later, I decided that I wanted the surgery done. So I went to Dr. Githaiga, who diagnosed me with gigantomastia in October of 2019. I could not run. Not really, I couldn't, but it was, you feel the weight. I hated mopping because of the weight. Going to the gym, I never did that. I tried once and I just gave up. Most of the time, I had extreme back pains. It was back and the neck. A certain doctor gave me orthogel. It's an ointment that you rub on your neck when you feel the pain. I actually used to wear two bras. What I would do, I would get one that is not padded and put it on the inside, and then so I'm actually wearing 2 bras, and this is extra weight. My mom has very large breast, and then her sisters don't. And then my sister, her breasts are not as big as mine were, but they are quite big. I hated myself. I cannot tell you the number of times that I just locked myself up in a room and cried. There is a lot of stigma, and especially towards breast reduction surgery. And every time I walked around, people used to hurl statements that are not so good. They're like, kwani umebebea dunia yote? Madam, unaanguka. You know, I had my surgery done on 14th of December. It's a 4-hour surgery. I can't quite compare that feeling to anything else because I just woke up very, very light. And most of the people in my office have actually said that my confidence has just been boosted and I'm a totally different person. And the first time that I went to try on clothes and bras and everything fits, I cried. And that's what I really wanted. I just wanted to act like a normal 25-year-old. The surgery in itself is quite expensive, but I went through the foundation. The foundation takes care of 70% of the cost. So if you feel like you want to have the surgery done, you can contact the foundation. They will help you and they will take care of the 70% of the cost.
So gigantomastia, a huge name, but hey, today we take time to break it down, and to help us along with this conversation, Professor Stanley Ominde Kainga, who is a consultant plastic surgeon at the Da Vinci Medical Group Center for Reconstructive and Plastic Surgery. Thank you for your time. And of course, we're joined by Ruth McKenna, who's got lived experience with gigantomastia. Thank you for your time. Now, we all develop differently during puberty, but what would make some women develop excessive growth of breasts?
Excessive breast growth can be genetic, or it can be due to target cells. Those are breast cells being hypersensitive to the hormones that make breasts develop.
Normally, when does it happen?
Normally, breast growth has to end between 17 to 18 years. But in some ladies, you find that even before that age, maybe from 12, 13, the breasts are very, very large, and the patients become uncomfortable, and symptoms start emanating from that excessive growth.
Mm-hmm. And pregnancy has also been listed as a likely cause.
Yes, but you see, the breast has to prepare itself to feed the baby who is going to be born. And therefore, the breast tissues now has to develop and prepare itself to produce milk, because that's the factory for milk production.
Mm-hmm. So when does it now become abnormal?
Abnormal is when there is no physiological demand like pregnancy. Maybe a child from even 12 years, we have seen those kind of cases. Or it can occur beyond that due to other causes like obesity.
Ah, okay, so let's hear from Ruth. When did you know things were a bit different?
I was diagnosed with Gigantomastia 10 years ago. I was 25 years old at the time. So I had recurrent shoulder dislocations as a result of the weight. So when the orthopedic surgeon was fixing my shoulder, he actually noticed that my breast growth is very abnormal. So that is when he introduced me to Prof, and I walked over to Gachanja with my mom. But up until when the orthopedic told me that I have an abnormal breast growth, I didn't know there was anything like Gigantomastia.
Okay, so you did not know about the name, but you had noticed that your breasts were different, right?
Yes, I noticed my breasts were different because I was not the same size with my peers. Mm-hmm. Like you see, my breast size shot up from high school, from high school up until university.
So at this point, before getting the diagnosis, what are you thinking is going on?
What I was just, because a woman, a breast is what defines a woman or a lady. So me, I'm like, I have boobs, I'm bigger than you other people.
Yeah.
Tuendele na maisha, let's tusukume maisha. Yes.
All right, so daktari, they say it can occur spontaneously. So would you say that's what happened with Ruth here?
I think Ruth, when I saw her, she was on the higher side of her weight. Junk food is one of the cause of gigantomastia. Another cause could be genes. The genes determine how big the breasts will be and for how long they will continue enlarging.
So we're talking about genes. Is there anyone else in your family who has this condition?
No, I was the only one.
So this was the first time they were seeing this?
This is the first time they were seeing it. And I've come to learn that you should always trust a mother's instinct. Because my mom used to tell me, I think you need to go and reduce your breasts. So I'm like, reduce my breasts? What are you talking about? Because she had seen that they're abnormally big.
Professor, does it occur in men?
Well, it occurs in men. And it's also related to abnormal levels of estrogen. Men also produce estrogen. But it has a different terminology. It's called gynecomastia. But surprisingly, McKenna here, she should have presented with other symptoms like neck pain, shoulder pains. She could have had frequent headaches. She should have had back pain, abdominal posture, a poor abdominal posture. You tend to bend forward, say a hunch. And in fact, when you reduce the breast, they have problems in walking. At times they have to be trained on proper walking. really some patients we find they have even fracture of the vertebra.
What other symptoms did you deal with?
My neck pains. My neck used to pain a lot because of the strain. Because when you wear the bra, the bra straps dig into your shoulders and you're left with grooves on your shoulder. Yes.
And when you'd sleep, would you?
There's choke.
Yeah.
Sometimes they'd come and choke you. So before you sleep, you have to compose yourself. Like, this is the position I'll sleep until morning.
Okay, now, Daktari, I was reading up that some patients deal with the loss of nipple sensation.
When the breast is overweight, it tends to pull away from the chest, and we call that ptosis. It stretches the nerves and the vessels, and when it stretches the nerves, then the sensation is affected. And then you find in some patients there's ulceration. There are wounds, especially at the base of the breast, because of the distance of blood supply from the vessels in the chest.
Now, does the excessive growth of breast tissue happen on both breasts? Okay, of course, Ruth says it did for her. Is it always the case?
Yeah, it is always the case, but you will find differences. You may find a difference of, say, 100 to 200 grams. If it's a mother who's breastfeeding, the one that is being breastfed more, being used more for breastfeeding, becomes larger.
So Ruth, you said from high school over to second year is when you noticed that huge difference. How many years are those?
Like 6 years.
6
years.
years.
6 years, yes.
Okay, and was it a gradual growth or you would have growth spots?
I could find like after every 6 months I had to change my bra size. Yes.
At this point, are you even finding bras that can fit?
Oh no, you can't. You walk into a shop like Woolworths and they look at you like, what have you come to do here?
We don't cater.
We don't have that size. Like I remember there's a time I'd gone to visit my brother in the United States. And we walked into Alin Brandt, and the lady looked at me and like, we have to custom make you a bra, you know? Wow. So you left like, I mean, this is a bra shop. We should be able to cater for all sizes. Yeah. It was a bit frustrating at the time. So you even find yourself going to Mitumbas, second-hand bras, because probably you'll find a size here and there. And, you know, the shame when you go there. Like, you know, the way hawkers can be ruthless. Yeah. Like, there's one patient who told me, she was told, hii kifua yako hatuna hapa. You can imagine. Or you find ladies buying, yours is 1,000 because yours is big, and others are buying for like 50 bob. So you see, it's a bit, it gets to you a bit, but I thank God I didn't get there. Okay. So it's just experiences that I've had from the girls that I've tried to assist.
So Daktari, if Ruth never got the assistance she did when she did, would her breasts continued, or would they have continued to grow?
Well, I think they would have reached a stage where they would have stopped. But the thing is, you couldn't reverse what had already been attained. It's only surgery that could have corrected that.
Okay.
Yes.
All right, we take a short break. When we get back, we'll hear from Ruth. She's mentioned some of the experiences she's heard of, but I'm sure there's some stuff that was also told to her because of how she looked. She'll tell us more in a moment. We'll be right back. And we're back. The conversation is Gigantomastia on Health Diary. My name is Gladys Gachanja. We still have Dr. Stanley Ominde Kainga. He is a consultant plastic surgeon at the Da Vinci Medical Group. And of course, we have Ruth McKenna, who has had lived experience with Gigantomastia. Now, before we went to break, you mentioned that you've had other people's stories, you know, but I'm sure you also have yours. I mean, you're going through high school, you're going through campus, and stuff is changing faster than you can explain. Yes. What are people saying around you?
Like, I remember there's a time I was walking in town. Then you could hear, like, makangas, you know, like, chekule wa matuzo, you know, wa manyonyo wamepita. So you can imagine, like, really? Then there's a time I remember I was picked on in class. Because I had very big, it was a biology class. Then you see the teacher was like, now you see like McKenna here, she's a good example of the reproductive system. So you're like, oh, okay. So with time, I had to like develop a very strong defense mechanism, because it got to a point like I felt like people are bullying me, or you're trying to push me because of my breasts. So I actually became a bully. So you'd tell me something and I'd look at you and I'd give you a very bad response. Yes, I had to really be strong for myself at the time, yes.
Is it having a hit on your self-esteem?
It didn't say it really hit my self-esteem, but to some point it did, you understand? Because you're feeling like you're not like the rest of your girls, like maybe when we're going out, you can't dress like these other girls. You're feeling, now, why can't I dress like my other peers? So you're just there with a t-shirt and jeans throughout, because that is those are the only clothing that can comfortably accommodate you.
So you have limited choices.
Yes, I had limited choices. Like in campus, I used to be branded the jeans and t-shirt girl. Yeah.
Daktari, I'm sure you've had a lot in your line of duty. What are some of the things you see with the patients that walk through your door?
Yeah, it's a problem. In fact, apart from the physical problems that these patients experience, is the psychological part of it. They get depressed. I've had a patient who was to go to university in South Africa, but because of a condition, Gigantomastia, she couldn't proceed until we did surgery on her. And it has also social impact. In terms of socialization, they become like introverts.
So you've touched on the treatment, and of course surgery is what you resulted to. After you woke up from the surgery, tell me how that felt.
I remember it like it was yesterday. So I woke up and I was very drowsy. Then I just propped myself up. And the first thing I did was to look at my bust. And I remember I had like balancing tears. And the nurse was standing next to me and she's asking me, what are you looking at? I'm like, in my head, you don't understand. As in, these things are no longer on my laps. They used to sit in a, they escort you, they're like supporting documents. So you're like, my laps are all clear, as in I can see my thighs. But she's like, how many kilos were removed off your chest? I'm like, no, said 7.3 kilos. You can imagine, those are like 2 newborn kids.
And after the fact, Daktari said you did not have a hard time adjusting to your new normal.
I did not. I think it was like a 360-degree stand. Like, you walk into a shop, you're the one who was telling me I can't get a bra, give me now. Even that confidence and the way you're saying the self-esteem is like really up there completely, yes.
Daktari, what are the treatment options out there?
Of course, there are drugs that can be given to counter the hormones, but as I'd already earlier said, once the breast has developed to that big size, it is surgery that is the only option. You will find that on the outer side of the chest, there is more tissue, fat tissue, and that kind of tends to deform the appearance of the breast. So we liposuck those areas and we laser to tone the skin. So it comes out very, very nice.
Now, Ruth, you mentioned, or I have read this about you, that you lost your nipples, right?
Yes, I lost my nipple sensation because the technique Prof used at that time, that was like 10 years ago, we're talking about a decade. He used something called a free nipple graft. I think he's best placed to elaborate on what exactly that is, but that's what he did.
So was this an option because of how big she was?
Yeah, that was the reason why we did that. She was threatening to ulcerate, really. So it meant that the blood supply to the nipple areola complex was quite tenacious. There are disadvantages, of course, failure to breastfeed. But over time, we have improved on our techniques. We no longer do free nipple grafts.
Okay.
We just do pedicles, and most of our patients, all our patients, should be able to breastfeed.
Are you concerned about the breastfeeding?
No, I'm not.
Uh-huh.
I just tell myself, even orphans, have they died because of not breastfeeding? And their mothers even who give birth and they don't have milk.
Yeah.
So for me, I normally look on the brighter side of life.
Treatment. This is an expensive affair. How did we manage this?
I can say by the grace of God, my parents were able to come up with the amount, and I had the surgery done successfully.
Daktari, not everyone can afford that amount. Do we have an HIF catering at least for something?
NHIF apparently is quite understanding, unlike the other insurance companies. But there are some that you can negotiate with on a package that this patient, this client has large breasts. They are not cosmetic or aesthetic issues. They are treatment, they are therapeutic. If they understand that, then they are able to pay.
Okay. And now, of course, the bigger question here is there a chance of recurrence?
The issue of recurrence can occur in those patients who develop this condition while they are young. With those ones now, you tend to maybe over-resect. But with experience, you know that this is what, even if it overgrows, it won't become gigantomastia.
When it comes to psychosocial support, you founded
The Gigantomastia Foundation.
Yes.
Yes.
How does it come through in helping other people who live this reality?
First things first, why I founded the Gigantomastia Foundation is mostly because of awareness. You can imagine how many girls or how many ladies are just seated in their houses without suffering in silence, without knowing that this condition is treatable, and more so in Kenya. And to get out of this cocoon of some of them have been cast, others think that because you have big breasts, you started knowing men early. You know how in Mashinani people talk, yes. It's good that to make people understand that this is a condition that needs to be given attention. And as Prof has mentioned, like you see the young girls who are like 13, you know, the future is bright for them. And here's a child who doesn't even know what's happening to them. So I partner mostly with the county government to help such young girls, you know. Others even they're from houses that you can even barely describe, you know. And you're being told surgery is 500,000 Kenya shillings, honestly. This child doesn't even know where the next meal is going to come from. So I try to link the patients with the surgeons and even walk the journey with the patient, just for them to understand that they're not the first.
Okay. Do you ever do some sort of counseling to the patients before these procedures are done so that they also know that they got the stairs because the boobs are big, now they will get stairs because things look really good? That can be a huge shift.
Yes, we take them through that, and that's part of management. Ideally, these patients make 3 visits before we actually operate on them.
I know this is something that is, you know, your heart's desire to change the quality of life for all the women that have walked in your shoes. How do you help them out, especially when it comes to that bit, the mental health, because most of them really struggle through this journey?
You deflate that person first, you know, and you take that person step by step. It's not like you come today, then tomorrow you're ready in theater. You need to take that time. You can even find their patients who are so anxious that, when am I going to theater? When am I going to theater? Then when D-Day comes, oh, reality, yes, yeah. The reality checks in, I'm going into that theater for 3 to 4 hours. So you see, you have to be psychologically and mentally prepared.
All right, so there definitely is a life beyond a diagnosis. Ruth McKenna, lived experience with Gigantomastia, and of course, Dr. Stanley Ominde Kainga, who is a consultant plastic surgeon at the Da Vinci Medical Group Center for Reconstructive and Plastic Surgery. Thank you for this session. It really is informative and an eye-opener for many. Time now for the health tip.
Teeth are very important in a human body for various reasons. Number one, they are where digestion of food starts, so they are very important in nutrition. A person without teeth cannot eat whatever they want, and therefore that will affect their nutrition. Number two, aesthetics, because teeth are the ones that support the facial muscles. So therefore, if you lose your teeth, it means then your face is going to collapse. Number three, teeth are very important in phonetics or speech. There are some letters that you cannot be able to pronounce if you do not have all your teeth. For children, teeth are important in all the above, but most importantly, milk teeth are important for preserving space for the permanent teeth.
Another learning point here on Health Diary. Thank you so much for your engagement on our social media platforms. Keep them coming through. Well, we've been coming to you from the 4 Points by Sheraton here in Hurlingham. My name is Gladys Gachanja. Until next time, bye-bye. Jipe shughuli producer. Thank you very much. When in poor.
But we can liposuck. We narrow that. Yes, we narrow.
Oh, it's died. Oh dear. You know, he's the VVIP here. Without his information, we don't have.